welcome back to Morning Cafe, and we're going to head straight to the health segment as we get to dissect chronic kidney disease with Dr. Victor Ngani, who has joined us here today. You know, even as research estimates shows that 4 million Kenyans have chronic kidney disease, with a significant proportion of this population progressing to kidney failure, projecting it as the 5th leading cause of death by 2040. Such a sad aspect there. So karibu sana daktari.
Asante sana.
Yeah. So maybe you could elaborate for us what is chronic kidney disease.
Thank you very much, Modoni.
Yeah.
Now it's important for us to contextualize where you started.
We start with kidney disease.
Yes, we are actually. When you speak about 4 million people, actually it's 4.5 million people. 4.5 million people have chronic kidney disease, and a majority of these people don't even know they have it. But that's about 10% of our population having this significant issue.
Yeah.
And of this number, about 15,000 now need dialysis, and only about 10% get adequate dialysis. So what is it? The kidneys are generally two when they're normal. You have two kidneys. They're about the size of the mouse, just the one you use for the computer. And their role is to wash out waste products, toxins, get out excess water. But they have other functions also. They promote production of blood, make your bones strong. There are some hormones produced that are actually involved in critical body functions. Now, when the kidneys can't work there they're supposed to, that is called kidney dysfunction. Now, the kidneys can be damaged by many, many things. We'll discuss that as we go along. But any form of damage to the kidney then creates a situation where the kidneys are dysfunctional. Now, depending on how long this damage has been, we may say it's acute, meaning it's happened in a short time, or it's chronic.
Yeah.
Now, chronic kidney disease is kidney damage that takes place over about 3 months or more, sometimes many years, as opposed to acute, which happens very quickly and very suddenly, and often is reversible. Chronic disease affects the kidneys. If you don't reverse it very quickly, it will continue progressing to a point where you get kidney failure.
Oh my goodness. Okay, so before we get to go on further with this, you've said that at a point you might have the disease, but you don't know that you have it. And even before we get there, you know, there are people out there who, you know, champion it and say, nimesota hii wiki wacha nitauza kidney. But, you know, what do you mean by you can have it, but you don't even know that you have CKD? Maybe I could initiate it to that.
Yeah, you know, it's very strange because many of us have seen kidney disease patients and they look so sick. And you cannot imagine when a doctor says that most patients don't even know they have it, because you don't realize by the time you become that sick, it's because you've had the problem for many years. It's just that we are not in that habit of having ourselves checked. And so it's the symptoms that alert us the presence of the disease. So actually, kidney disease, as much as it's very dramatic towards the end, early on it's completely symptom-free. So you can actually have your kidneys being affected significantly for well over 2-3 years, or even longer than that, and you don't have any idea that you have such a problem. And the only way to tell this is when you visit a facility, have your blood levels, blood urea levels checked, or even sometimes just from the urine, we check if there are traces of some protein being produced there. Those are the earliest signs that you have kidney disease. In the absence of such a check, many people only know that they have kidney disease when their kidneys are so damaged that they require some form of medical intervention.
So does it major largely with nutrition?
Nutrition has a big component. But then in the country today, and perhaps we can talk a bit about some of these causes, the biggest reason why we have kidney disease is diabetes and hypertension. And when you talk about those two, then you understand that nutrition is a big part of these two areas. Cumulatively, in terms of causality, chronic kidney disease, up to 70% of the cases are attributed to these two diseases, diabetes and hypertension. And what is it about these two? When they're poorly controlled. If they're adequately controlled, then you limit the progression into this kidney disease. Now, 30% of all chronic kidney disease cases are in patients who have both diabetes and hypertension at the same time. Another 20% have only hypertension, another 20% have only diabetes. So 70% of chronic kidney disease these are related to inadequately controlled, inadequately treated diabetes and hypertension. So what then is the contribution of nutrition to these two diseases? It's huge. Diabetes we know, hypertension we know, addressing our diet, that's significant. But of course there are also other lifestyle choices that we can make to promote our health and prevent progression to these kinds of diseases. One, in 2022, you have no business smoking. I think I've said that like 7 times. I'll keep saying it. Just recently in the Fearless Summit at Mavuno, we learned that there is a lot of advocacy that promotes certain certain things. And if you come across a situation that defies logic, like smoking, then you understand there's a big industry behind it that promotes it. But we have to be wiser than that and stay away from smoking. There is nothing beneficial in it at all, and it's harmful. The other thing is, of course, excessive alcohol intake. And then now we lead sedentary lifestyles. We don't exercise anymore. It's something that we speak about, and I'm not saying doctors are exempt, even doctors. And as a result of this, then we may have ourselves in difficult situations. And we love nyama choma, we love the fast foods, we'll have all these fatty processed foods, as opposed to what our forefathers and foremothers brought to us as options. Yes, all these factors have changed our society a little bit, and they've predisposed us to all these risks that then can cause chronic kidney disease.
But nowadays, so many people are for the go-to card of alcohol, and they're like, I can't stop. Even though it's what they get to do when they get to the shops, they just look at the percentage and they're like, nitakunywa tu. So what happens to that person who gets to take it over the years? And we have this notion of great grandparents used to consume alcohol content, and they lived for way too long. So what has changed?
Okay, so 2 things there. Number one, alcohol, the traditional beers were meant to be social drinks. So you'd have in a gathering, then there was theirs, and not just anybody. Okay, maybe, and even the bigger portion of the population would have some form of social intake. But then they were really hard workers. They'd go to the shambas, and you'll not find drunkenness being something that is glorified as is in the country today. I think it's become thematic. We are seeing a situation where the young adult, they are walking around with tumblers with alcohol in it, and it seems to be like the in thing, which again defies logic. And you find people who had a great future in life, somehow many of them are falling into a situation where they can't come out of it. And it's extremely sad, because alcoholism is a disease. There's a point at which it goes beyond what you can control, and to a point where you can't control it. And perhaps, Mudhoni, we should have another show about alcohol in particular, because
I agree.
That's an area we can talk about for a very long time. I think if you listen to this show, and you're not yet too far gone in this direction, it sounds like it's fun, but understand that it's an industry discussion that's affecting you. If I did a CT scan right now, and I'm not talking about the kidneys, let me digress a little bit. And I found that the brain is shrunken, and there's a lot of water. There's actually a version of it that is not very pleasant. And then there are 2 possibilities. One is that this person is advanced in age, and this is normal. We kill a lot of cells. Or you drink excessively. So if you see a 40-year-old person whose brain is shrunken, lots of fluid around it, 90% of the time alcohol is involved in that case. And there are many other factors that we are not aware of. Now, back to kidney disease. If ever you think you may have kidney disease, please stay away from alcohol. It may sound like it's something you must have, but then what happened to the power of self-control? What happened to being a strong person? What happened to being, not even character, just being able to control what you do? Because it's not an option that you must indulge in.
Even though, as we looked a couple of minutes back on nutrition, there's a recent trend as of now where so many young people are making money out of eating fast foods, and their bodies are way too huge, but they do not care about that anymore, because they're like, the more I consume this food, which is actually being sponsored by some of these companies, the more you get to earn, because as of now they're getting to earn about 1.4 million Kenya shillings per month. The more you continue to digest their food, that is what is happening at the moment. So what happens to this person, when they get to look at the part of nutrition?
Well, I'm not even aware that that's a thing right now.
It is a thing.
And that's extremely shocking. And of course, I can imagine the difficult economic times can push someone into that direction.
Yeah.
But my working life, I worked in ICU most of the time when I was on the bedside. And I can tell you that there's one thing that trumps all the money in the world, and that is health. And I've seen people who are as rich as can be, at the point where the money cannot make a bed. You know, they wish they could take away all the money they had just for good health, and that's not coming. And so from a very early age, we have to take care of our health. And the funny thing about these long-term conditions that we talk about is they start from very early on. The decisions we make that don't seem so significant, to not exercise, to drink too much, to have excessive food, they actually have an impact. And right now, obesity and BMI that is increased is a big contributor to many illnesses, be it cardiac disease, be it diabetes, be it cancer, be it kidney disease, any of these issues. So in fact, if you can do something about your weight from a very early age, then it will help you going forward. Again, I must say with this with respect, because not everybody who has increased BMI is because of excessive indulgence. Other people, it's genetic. And so it's not something that we can 100% say that because you have you've increased weight is because of other factors. There are many issues that contribute to this. But if you can, please do something about it. And what do we do? An active lifestyle. Watch what you eat. Go to the not necessarily to the gym, but exercise. An active lifestyle that allows you to lose, utilize some of the calories that you take in every day.
So what are some of the symptoms? Though you've said that they do come at times way too later on. What are some of the symptoms that one should monitor when looking at the chronic kidney disease? Yeah,
so the first thing that I want us to note is let's assume there are no symptoms, as happens with high blood pressure, same to chronic kidney disease, and get into the habit of having your kidneys checked at least once every 2 years if you can, and if you're below the age of 40 and above the age of 40, at least once a year have your kidneys checked. So the simple checks don't
once a year.
Once a year, just pass by, see a doctor, and if you can't now, once a year, once every 2 years. But then later on, if you miss the chance, then early on you'll see things like fatigue. Just basically you're not as energetic as you used to be. You feel that you're getting some form of brain fog, and your ability to concentrate is diminished, and your ability to just perform normal functions, you feel as if you're not at your capacity. You just feel fuzzy. That's one of the earliest symptoms. But then later on, as it progresses, then the water begins to accumulate, and you begin to get swelling in the lower limbs. Your face can become puffy in the morning when you wake up, especially, and then in the course of the day it becomes a bit better. You can have some level of breathlessness. There will be some scent. I don't know how to describe it, but it's a scent like urea. And then you may have some spots on your face that are whitish, like small crystals that are crystallizing. And then the urine that you're passing, you see it's reduced significantly. And then because of other factors also, your blood level begins to go down. Then you can have your heart racing, many such complications. Now, this is what you'll probably see.
So what, you have said that not so many people do get the time, or rather they're scared. So do we have a society which is still, stigmatized on that? You don't want to go for a health checkup?
No, there has been, and across board for any kind of illness, I think our society, there's a lot of progress, but we're still at that place where being sick for some reason, people do not view it the right way as it should. Fortunately, there are societies that are supporting. I think there is an association that is made for kidney patients, and they've been doing a good job. I think they've advocated successfully for lots of the changes we've seen. Some of the payment options at NHIF, I think they've been part of these kinds of policies. So yes, there is stigma in the society that makes it hard for someone to go for diagnosis and testing. But then remember that when you actually present late, the same society will not be there to reverse that. So we lose a lot by not presenting early. So just come, get checked, and you'll discover that in fact with early treatment options, and now there There are many facilities, like where I work right now. If you have kidney disease and it's diagnosed early, you can actually go through the next couple of years without requiring dialysis. And that's the essence of what you're trying to do, limit progression. Yeah.
All right, Dr. Victor. Now, guys, it's time to take a very short break. We will be right back with more on this topic. So to keep it right here. Despite being visually impaired, he is a jack of all trades. It is our quest to find answers on how to take care of children with special needs and those with disability. You do not need to see musical notes to understand music, but rather to have your soul feel the vibe.
Actually, for us to make a wheelchair, we have to take measurements of the user.
After doing my assessment, I get to know the parent, I get to know the heaviness she's carrying.
Disability comes at different stages of life.
Well, do you know what's happening around you? Morning Cafe with heated political debates. Baraza la siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business, farming. Tasty Wednesday, Fitness Thursday, and Feel Good Friday with amazing DJs, celebs,
waimbaji, kuna comedians, alafu kuna wajinga,
and music bands every Monday to Friday from 6 a.m. to 9 a.m.
What is chronic kidney disease? Here with Dr. Victor Ngani. Now, Daktari, you said that about 15% of people in Kenya can access the services, the dialysis services, if I'm not wrong with that info. How is it for the Ministry of Health? Are they yet to up their game on that, or are we lagging behind when it comes to dialysis?
Yeah, about 10% of those patients who need dialysis are able to get adequate dialysis. Yeah. So there are those who are getting inadequate dialysis, but adequate dialysis is just about 10%. That's about 1,500 people. But I must say that there's been significant progress over the last 10 years. There was a time when if you had kidney failure, you had to come all the way to Kenyatta, or maybe two other centers were able to do this. Now we in excess of 75 centers, although many of these are still private hospitals. Private hospitals have done a good job in elevating the kidney care. Of course, we are still far from what we need, because we need another maybe 10 times what we have right now. Yeah. There is definite progress in that direction. And it's good to know that one of the leading centers for dialysis in this country is a government facility, the Moi Teaching and Referral Hospital. Their kidney program is fantastic. I think it's one example that public sector can work, and it can work well. And it comes, there's a lot that has worked in that system that can be replicated across in many areas. And then, of course, the other thing that needs to be done is that the support to private hospitals for dialysis has to continue as well, because it's not possible for government to give dialysis across board. Most of the centers, as I said, are private. And what made the big difference is when NHF started paying for dialysis. Yeah. It's not cheap. It's 9,500 per session, and you may need 2 to 3 sessions in a week. Imagine that. So basically, you're talking about almost if you need only 2 sessions, it's about 80,000. How many families can afford 80,000 on dialysis alone? I remember being an intern. One of the saddest things we had was to diagnose someone with kidney failure, because chronic kidney failure, because chronic kidney disease that had progressed to failure, because it meant we'd have a tough conversation. And this is not a very long time ago. This was back in 2007. And I would ask you whether you can afford to pay 80,000 every day for the rest of your life. Every month for the rest of your life as a family. And because what would happen is someone would get sick, then they sell the property they had, which take them through dialysis for 6 months. And then after that, they have nothing, and they still pass anyway, but now everybody else who's left behind is destitute. And that was the pain we were in, and that changed when the government started funding dialysis through NHIF. Now, given the impact of that project, it means we need to escalate, not de-escalate that kind of care. And it was opened up beyond public hospitals to private hospitals could also now give dialysis, private centers, and this has been useful. Of course, when this happens, we must also pay attention to quality, because there are business opportunities to come to the space. They do not have the capacity to do it, and they begin to do it, which puts other patients at risk. And so at this juncture, I would recommend that any person who has kidney disease be checked in a decent hospital, a place that has a history. There's an association that knows the centers that have been working, and be part of that team as well. And then from a government side, please step up, don't de-escalate the kind of care we are giving. Let us increase that provision by almost another 5 or 10 times.
So I'm being asked here, what is the role play of alcohol once one gets to consume it? And also, let's not talk about alcohol alone, because on the other side, there was a law that was introduced in France for so many people who want to look like they're a preferred celebrity. So they get to do intermittent fasting, where you just, you can go for a whole day without eating anything or consuming anything to attain a certain body shape. So what does, those two things do to your body, to your kidneys? Yeah.
So fasting in itself is not problematic, except if you don't take fluids at all. And one of the key reasons why you may lose your kidneys, you may lose kidney function acutely, is decreased fluid volumes in the body, dehydration in particular. So for many reasons, either you've lost blood, or you've not taken adequately, or you're vomiting and passing loose motions. And so if someone doesn't take any fluids for an extended period of time, then you're going to have an issue in your kidneys. And then generally nutrition is decent and it's helpful. So if you starve yourself, starvation affects your whole body, including the kidneys. And therefore, there's a difference between fasting and starvation. If it's fasting as a practice, that is something that actually is done religiously as well, and it's not harmful. But if it's starvation, where you're not eating, you're trying to, you really just lose all your weight, then there are risks there as well. In terms of the things that we ingest, not just alcohol, but the things that you take in that are not directly, can I say, part of your body system. It's the toxins that come out of this, the metabolites, whatever it's broken down into, that then have an impact on your body functions, whether it's cigarette smoke, whether it's excessive alcohol, and then the handling of these issues within these foreign materials in your body, how your body handles it, strains your organ systems. And then remember that it's not just your body isn't just that one organ. Your body is every organ system. So if alcohol contributes to high blood pressure, or it contributes to diabetes, and we know that diabetes and high blood pressure contribute to kidney disease, 70% of CKD is these two diseases, then you know that by extension alcohol is excessive alcohol is contributing to this as well. And the impact of that on nutrition, there are many factors that relate to that. So generally, anything that harms your health, even though it may not seem to directly affect a particular organ system, will affect that organ system. Yes.
So in regards, when one gets a kidney failure, you resort to a transplant. So what is the whole process that, makes you as a patient, or rather as a donor, where we were heading to next, to be a good donor or receiver of the said kidney? What are some of the factors that you get to check?
Yeah. So your body is very good at eliminating foreign items, including human parts that are not really yours. So if I was to give you a kidney that doesn't belong, it's not yours, then the body automatically identifies it as something foreign and creates a whole defense system that sort of tries to get rid of this foreign body. And this is a big issue. So one of the things that we must do is make sure that the kidney being donated is as close in genetic makeup to the person who's receiving it. This is they are sort of a match. And we do some extensive tests to make sure this is possible. But then from the donor side, you also have to be very careful, because a donor is not a sick person. A donor is someone who's coming to help. And so we must make sure that they are healthy and that they can live with one kidney. It would be a disaster to take out one kidney and then they are left, either they didn't have a kidney from birth, or the other kidney was a bit damaged. And so you have to be sure about that as well. And that when the transfer happens, the person who's receiving it is in a state where the kidney can remain healthy. And that sounds very simple, but it's a significant issue, because you can get a kidney from a donor who matches, who's healthy, but then your body at that particular time is not strong enough to sustain that kidney, and therefore you lose the kidney. So ensuring the person receiving the kidney is also in a state where they're healthy enough to receive a transplanted kidney, and that it takes, that will be very useful. But however, after that, there is need to continue taking some medication. No matter how close the match is, you must take some medication to reduce what is called graft rejection, where your body will fight the kidney that has been implanted. Yes.
So huku nje, when people are broke, they get to say, wacha niuze kidney.
Nakuwa nice. I'm going to do this.
So how much does a donor get paid for one kidney?
Let me do the math. How much do we pay donors for? In Kenya, when a donor comes and donates a kidney, they get exact how much? It's approximately 0 shillings.
You got to be joking.
Yeah, when you watch a lot of television, then you imagine that you're going to be paid millions of shillings for donating a kidney. Actually, it's free. And normally, you find that most of the people who get kidneys get it from very close people who care and say, you know what, I'm going to give you a kidney. It's illegal in the country to go ahead and do that. And but be worried. If you are looking to be the victim of human traffickers who are looking for Kenyan people who have bought into the thought that they're going to sell their kidneys. Yes, you'll go with them. That they do whatever it is they're going to do, and you'll get no money as a result. In Kenya, we don't pay at all. I know there are human traffickers in Asia who are very much in that discussion. Again, it's up to you if you feel that is a kind of team you want to hang around, and if you can trust them to support you in any way.
So tuambe, if ukiona umesota kidogo kidney huwezi uza.
No, not in Kenya.
Right.
Strike that off your list of the get rich quick schemes.
Out of the bucket list. So for the donor, does the donor still have to take any sort of medication after donating the kidney?
Fortunately not. Okay, you have to take medicines to get better if you have maybe an infection or something or some pain, but beyond the transplant period, no. And I think there are thorough processes to select the donor in a way that you expect this donor to have a normal life after. Fortunately, one kidney is normally enough for you to get through life comfortably. And we rarely see complications when the selection process is clear.
All right. All right. So maybe your parting shot as we get to the tail end of this health segment.
As with all diseases, Modoni, and Kenya is now an educated population. Let us get diagnosed early. Let us get to the habit of having regular checks. The checks sound expensive, by the way. But then imagine if it's going to save you from spending that much money, and it's going to give you good health over a long period of time, then getting checked is of great benefit. So my recommendation, get into the habit once every 2 years, at the very least, pass by a facility, and those checks aren't too expensive. Have it as part of the things that you do to know what your health status is. It can discover more than kidney disease. The second thing is we have to follow, take after our forefathers, our grandparents. Those they didn't have PhDs or masters or anything, but they were brilliant guys, and they wouldn't allow for excessive things that don't benefit us. And therefore, let's not fall into the traps of, can I say, industry marketing that allows us to excessively indulge in things that are not beneficial to us. And then finally, if you have any of these illnesses, please, it's not the end of the road. It's important to just pass by a facility that's accredited, that can do a good job, and then slow down the progression. I have many finalies. If you have diabetes and hypertension, please control these illnesses, because controlling those illnesses reduces the risk of end organ dysfunction. If we control diabetes and hypertension, then in the same way we will reduce significantly the risk of these long-term end organ dysfunctions that we have. We can take that further and say we can stop ourselves from getting into this state by exercise, by watching what we eat, by lifestyle modification, to give ourselves a good chance. Yes.
Absolutely. Yeah. Thank you so much, Dr. for your time, and I wish that we actually had more time so that we can expound further on various issues, and you've said that maybe as some other time we will get to talk about alcohol on its on its own.
I'll wear a helmet so that when the people want to stone me for touching their pet subject, but maybe one day they'll hear what I'm saying, because there are many people who have gone through, families have been broken and lives damaged because of it.
So maybe you could give guys out there your contact.
Yes, please, you may reach us at RFH Healthcare. Our website is rfhhealthcare.co.ke. We have 8 branches now in Ruai, the level 5 facility, Ruaka, Ruiru, any of our facilities, Komarok, Kawa West, Embakasi, Tala. We'll be able to assist you. My name is Dr. Victor. Yes.
Thank you so much for your time. Now, guys, that's all that we had for you here on Morning Cafe. Thank you so much for tuning in and for sending us your feedback. We really do appreciate for that.